Hey everyone, it's Felicia here. Welcome back to my YouTube channel. We are going to be on the theme of routines, and today it's what does it take to get out of the door routine? And that all goes back to Kalia's emergency bag. And it's a backpack. We have gone through a big bulky red emergency bag to this nice backpack that is also a diaper bag. But I'm going to take you through just all of the things she has in here, her emergency items, backup trach, current trach, everything. And also outfit like your standard kid has. If there's a blowout, you need to change of clothes. And I'm gonna show you her stroller setup and what it takes to go for a walk, to go to the store. You will see why we kind of limit some of our trips. Mainly, obviously, it's a pandemic and COVID. We don't want to have extra exposure if we don't need to, but we still want to live and do activities. So we've gone to the pumpkin patch. We've gone to Hobby Lobby earlier today. We do fun stuff still. We go for a lot of walks, and I will show you just a variation of her setups. Luckily, we have been able to like cut back on some of the machines she needs, but some of them we just take for backup plan for emergency, but she doesn't actually use them on a daily basis. So let's go to the emergency bag first. All right, here is her emergency bag, and it is a skip hop diaper bag. We used to have this big red, actually, hold on, let me show you. All right, I'm back. So we used to use this when we first came home. It is large. It is like actual like professional emergency bag, and lots of pockets for like everything you might need. But we just realized it wasn't functional and it was just way too big for just what we needed. We're trying to get out the door, go on trips. We don't want to have to be lugging this around and trying to go through all the pockets to find it. So we went with our typical diaper bag that I got from my baby shower, honestly. So everything is organized into small little baggies so we know where everything is and everything's labeled. So I'll zoom in and really show you. So here's our up close and personal look at everything. We're gonna go over the first bag, which is all the things any diaper bag should have, let alone an emergency bag, is a change of clothes. So we have outfit for warm weather, cold weather. Always gotta have our little bow in there, socks. I need to start packing a shirt or something too, just in case, but outfit is always in there. And then we have your typical items. So we have our diapers here on the side, easy access. We're always kind of grabbing and changing her when we're on the go. So diapers here, we use this roll on the side for when we're doing trach care. So this is just like a little emergency roll for her because her shoulders have to be elevated in order for us to get to her neck. Come in this smaller pocket, gloves we use every time, whether the nurses are doing a diaper change or they have to give her a suction. And just with the times right now, we just want to make sure that we're just being really careful and clean with our hands. We also have sanitizer in here. These are all of our chargers, our car chargers for the two pieces of equipment, which is her vent and her suction machine, which you'll see shortly. So that's easy access ones. Here, same thing. Anything that we're going to be using more often, we put in these front pockets. So you have our diapers over here. We have our butt paste cream, which I love this brand. Honest wipes. I really like the water wipes too. We have these little Band-Aids that are for just a little extra protection for her. And then just little miscellaneous items in here. This right here is another roll. These are amazing Arm & Hammer bags. You also use them like if you have a dog and you're going for a walk to put their poop in. We do it when we're on the road. So it has this awesome little sleeve here. It's from Munchkin. And these, you just don't smell anything. So if we're traveling and we need to change her diaper in the car, in the backseat of the car, or just in the hospital, whatever it might be, and there's not a trash can near, we just wrap them up in here and then we'll toss them when we get home. Good investment. All right, so those are the items that you would see in any diaper bag. Now we're gonna go into more of the emergency items that she has. So in her bag, we always keep some records of Kalia's health and any of her medical complications, just in case we are having an emergency and we're calling 911 and we have everything here that they need to know. We also have contacts for her in here: emergency, local fire station, our evacuation plan, numbers that we need to contact, doctors, everything, and details about her airway right here. So if for Kalia, most kids, they don't have a trach. So if you call 911 and you have ambulance come, they might try to resuscitate her via mouth. Looking at this, you have to go through her trach, and she cannot be back from up top. So it has all the critical things any emergency first responder would need to know. And then this is what helps us know what's in her bag. So it's a checklist of all the items that should be in her bag, and our nurses check it every night after we go on a trip to make sure we restock and we have the essential items in her bag. So that's what we're gonna go through. Okay, so first things first, Kalia has a trach. She's got, right now she is on the 3.5 Bavonia, but we also have one size down, which is 3.0. So the reason why we have her size and one size down, in case anything happens and there's any swelling and we can't fit an emergency situation, her actual trach size in there, we go the next size down, and knowing that any swelling, we'll be able to get this one in here. So these are more of backups. So we have those two. And then kind of going along with trach, this is our trach care kit. So I'll end up doing a video on this, but her trach care kit is all about cleaning around her stoma. So we have Q-tips in here. We have sterile water to clean. We have her trach ties in here as well. So these are her trach ties that go around her neck to keep the trach in. And she also has dressing to protect her skin. So this is something we do every day. And just in case we're on the road and we need to do one, maybe she spits up and her dressing's super soggy and we got to change it there because we don't want her to have that on there, but also we don't want any throw up to get inside that stoma area. We want to clean it right away. Boom, we have our trach care kit. And we have our roll. And boom, we have our trach care kit. And then we have our roll, like I said earlier, that goes under her shoulders, just so we get that nice space so we can get to her neck. All babies' necks are just so small. Then over here, this is our small little bag, but these are items that we use often. Kalia's suction machine has these attachments where we can clean and suction out her nose through a machine. So this is for her mouth, and this is for her nose. It's called like a little boogie sucker, but they're great. And in here also is when Kalia's not on the vent, she's got a filter, HME filter that we attach to her trach. And more sterile water. We use this to rinse out her suction catheter, and sometimes just to put some drops in her throat to keep her airway moist. So these are things that we'll use pretty much every day, not just emergency situations. Then we've got a backup suction. Okay, so over here, we separate everything in to associate with itself. So this is her closed inline suction catheter. This is how we pull out all the secretion and we hook it up to the suction machine. So she rocks these every day, and we just have a few backups in this baggie. Then over here, we have everything that is dealing with her Gtube. So more cleaning, more sterile water, but also we use this cream around her Gtube site. Check out my morning video to see how that goes. But we have gauze in here. We also have a backup extension in case anything happens. This is the way food is moved through her stomach, through this open little area. And then whoop, this is attached to her Gtube site and goes straight into her stomach. So we have a few backup ones. So again, as I said, we bag everything by category. So you've seen trach, you've seen Gtube, and we can just grab and go and know everything we need is in that one little kit. So this is an extra circuit. This little green tube is for oxygen. Cali's not really on oxygen ever, but in case we have this attachment. This is a circuit for her vent, and it's attached to the vent and then attached to her. So just a clean circuit just in case. Last but not least is her ambu bag, which is for resuscitating her in case she needs some help breathing. or stops breathing, this is the highest level of emergency situation that we would be in. So this would serve as CPR. We learn your typical CPR, but we also learn how to use the ambu bag. So this would be attached to her trach, where the vent usually would be. And then we would actually manually give her breaths through her trach area. This can be attached to oxygen, which we take with us everywhere we go. So we can also do it that way. But Rome and I went through a training on all of these items, but the last part of the training was going through various scenarios that she might be in. Struggling to breathe, stop breathing, and what do you do when you don't, the responders, 911, ambulance, can't get there in time? How do we intervene and how do we help her? So that helped us kind of just prepare for those stressful situations, because we definitely believe that you can't just not talk about it. Be like, oh, we hope nothing ever happens, we're good. No, you've got to be prepared and talk as if things might happen and walk yourself through how you would handle it. Obviously, when you get to that situation, you're gonna be so stressed, you might forget a few things, but there are 3 or 4 things we have to always remember, and we're looking for those signs. Is she taking deep breaths? What about the color? What is she, where are her eyes? Is she focused on us? And so looking at her body and knowing those signs that she's struggling to breathe, that she can't breathe, and knowing what we would do. Is there a blockage in her trach area? Do we need to do an emergency trach change? You know, is she needing extra suctions? What that might look like. And so we went through every situation, and the what ifs we have down. And for us, this bag is our security. This bag makes us know that we're prepared for any of those what ifs. And then we have our nurses on top of that. So as you see, a lot of the items in here go from things that your typical baby might have, whether it be a blowout, then things around her trach for in case she throws up of some sort, and we need to change it in case she is having something in there that's blocking her from breathing. Boom. So we have those different variations, and then at the very end is her breathing. Do we need to help her breathe? And then, as I said before, having this piece of paper that has all of our information about her health and what we need to do in certain situations, who we need to call. That is what this bag is for, and that is why we always take it, and we always make sure it's stocked and it has all the things we need so we can move comfortably and get out the house. It's our security blanket to know that we can still function as a family and not feel we have to be locked down to one spot. So this is everything in Kalia's bag. I'm gonna pack it back up. So that is Kalia's emergency bag. A lot of supplies, right? So we take that with us everywhere we go. But as you see, there's some items in there that we use all the time that aren't so much an emergency item. And for those items, we want quick access to. So we have it set up in different places of our home and in our car where we have a caddy that we can quick access and grab those items that we're going to use all the time. So I'm going to show you our back seat of our car setup. This is our car caddy. It has all those quick supplies that we need more often. We got our gloves in here, our trach ties, and our Q-tips. We've got our syringes, our sterile water, some saline drops. Look at all this, gauze, suction catheters in here, and it is quick access. And you see, this is where her car seat will go. So anyone who's in the back seat doesn't have to go through that emergency bag to grab items. They can just boom, 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 and we stock it up every day. I will leave a link. And that's a wrap on what's in our emergency bag. So you see, we have so many different supplies, whether it be for her trach, for her Gtube, for her breathing, all in this bag. Some things we use daily, some things are just for emergency, but you're also able to see kind of our setup for the car. So in this video, I wanted to share with you how we are on the go with our supplies. So our backpack always goes with us, but when in the car, we have our caddy there, so we can just easy access. And then when we're downstairs, we have this little caddy, which is just pretty much a travel bag for your toiletries that we put our supplies in, and we have it downstairs. That's kind of like above her pack and play. So you just never know where you might be with Cali, but if you need something quick, you want to have it close by. So that's why we try to be really organized. But also when it comes to her supplies, we order them monthly and they go through our home care supply team. So I can't leave any links on where we get our supplies from, but we are stocked up and we have it in various places in our home to make sure that we always have enough of supplies for her, whatever it might be. So if you have any questions, leave them below. I'll share some links to the backpack, the caddies, but I hope this gave you just a little bit more insight into the life of a medical mom. Thanks, guys.